Now we are going to discuss a very interesting ECG. You can simply pause the video and you can try to find out the difference. Now these three ECGs are of same patient, and when you can try to find out, when you zoom in, the first and second ECGs are prior to doing the angioplasty to particular vessel. Now, when we see the first ECG, we can very clearly see that there is T wave inversion in lead 1. It is very crystal clear. In lead 2, there is this typical T wave inversion. Very nicely, the QRS is positive and there is T inversion. That is also T inversion is present in lead 3 and T inversion is present in lead AVF. You can very well see that there is T is inverted in lead 2. So in lead 2, 3 and AVF there is T inversion. It is the same story here, the lead 2, lead 3 and lead AVF. Lead 2, 3 and AVF, which suggest RCART, that is right coronary artery, is showing typical, very subtle but very prominent T wave inversion, which is persistent. Now, when we see other leads, we can also see that in lead V1, T is positive, lead V2, T is positive, V3, T is positive, and lead V4, the T is positive. But in lead V5, we can see the T inversion is there, and in lead V6 also, T inversion is there. So in lead 1, V5, V6. AV is also showing, but it is very subtle. It is not very well prominent. In the next ECG also, it is same that lead V6, lead V5, that very showing prominent T inversion, and T inversion is not there in lead V2, V3, V4. So this patient, when the CAG was done, this patient had DVD, that is double vessel disease, and this patient had actually LAD and RCA lesion. So this patient had blocked LAD and RCA. There was significant blockage of these two arteries, and that is the reason why the stenting was done to these arteries. And after doing the stentings, definitely the blood flow to the myocardium definitely improves, and that also then automatically reduce the repolarization abnormality, because T wave is all about a repolarization of the myocardium. So when there is reduced blood flow, automatically it takes more time for the myocardium to repolarize, and it can be very commonly, very subtly found by inversion of T wave. So T wave inversion is it can definitely signify that there may be underlying block, and it is not compulsory to have a block always, but it can be potential clue that patient may have underlying block. So this was the ECG after doing PTCA, stenting to the LAD as well as RCA. So for the RCA territory, you can see that the T inversion is gone. The T inversion is not at all there. And the prominent T inversion, which was seen in lead 1, it is gone here. It is not at all there. And the T inversion, which was there in lead V6, it is markedly reduced. We can compare this lead V6, lead V5. This T inversion to V5 and V6 was reduced, and the T inversion completely gone away when it was done to PTCA to LAD and RCA. So T inversion can definitely signify that there may be underlying blockage, which may not be always there. And after doing stenting to the blocked or thrombosed or affected arteries, the T inversion may markedly improve. This is what we learn from this ECG. Thank you.